So happening right now, September is Healthy Aging Month. And while aging is natural, it does come with a lot of uncomfortable symptoms, right? Like weight gain, sagging skin, low energy, mood swings, hot flashes. I know so many of you out there are saying yes, 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 but there are some treatments that can help. And so here to tell us more today, Dr. Jon Mendelsohn joining us, as well as Kati Vincent with Advanced Cosmetic Surgery and Laser Center. Guys, thank you so much for being here. I guess first of all, I want to talk a little bit about the misconceptions, because I do think a lot of people out there, you hear hormone replacement and it can be a scary topic. So what do you want people to know about hormone replacement? Is it just for women in menopause? Is it for men and women? Who is it for?
Let me start with my story just real quickly. So about 3 years ago, Cherie, I started with HRT, hormone replacement, which was testosterone. And after seeing a patient come in who's a friend of mine who looked great, felt great, started talking with him. And so for me, I was able to really focus in the operating room more. I felt better. My workouts felt better. I was seeing more results, clearer mindsets. I'm not really moody, but I was in a better mood. Sometimes I'm moody.
Kati might say otherwise.
So, but then what happened, as you know, probably 85% of our patients are women, and I really started paying more attention to some of the conversations they were having. And we see people for hair loss, we see people for skincare. And so we started to notice a couple of things. Number one, women are fairly open. So in terms of their libido and sexual drive and issues, we're talking about some of those things. But we were managing some of the complications like hair thinning, hair growth elsewhere. And what we recognized is that patients just really weren't being taken great care of. And one of the reasons for that is HRT, one of the routes of administration, is a pellet. You stick a pellet in your glute, in your buttocks, and you really can't control it. And so when there are erratic hormone levels, besides irritability and mood swings and all the other problems, you start potentially losing hair. And so we were managing that. So we began to focus and on women. We really loved men. It's almost for every man, not maybe every man. We want to be careful with that. But we really brought in about 8 nurse practitioners who are very focused on comprehensive care. When was the last time somebody spent an hour with a patient? So it's about lifestyle, it's about diet, it's about nutrition, it's about looking at other interactions, autoimmune diseases and so forth, and that's where Kati comes in.
Kati, talk to us a little bit about that. What are some of the treatments that women and men can get, and how is it beneficial?
Yeah, absolutely. So for women, usually we want to look at everything. So we start with the adrenal gland and looking at your stress levels. That all has a downstream effect to your sex hormones. So we look at the whole picture and we make sure that we're addressing every aspect of your lifestyle. And then we also, usually in women, we have to do both progesterone and testosterone. So they get that therapy either in an oral lozenge or in an injectable hormone. We can also add in peptides if it is needed. If there's a component of metabolism issues, if there's insulin resistance, we can utilize peptides to make them feel better and help them out on that level as well.
Look, I know I received a little backlash. I've had girlfriends of mine say, no, my doctor, my OBGYN says absolutely not. It can, cause cancer. Is there anything that you want to warn people, the myths that are maybe out there?
Yeah, well, there are both sides. For women and for men, perhaps with cancer, you do want to be careful with certain types of cancer, breast cancer in women, and the types of hormone cancer that those might be. You want to make sure that it's not one size fits all.
Right.
Okay, so it's very individual. For men, one of the myths has been the cardiovascular myth, and even my doc had said something about the risks of it. It's actually very, very cardioprotective. And they notice men with low T or low testosterone actually are at greater risk of some things. It helps endothelial cells, it helps blood flow, both for erectile function and for cardiovascular function. So there are some really wonderful things, but it's not for everybody, and it really needs to be managed in a comprehensive way.
Well, it just goes to show how much it's growing, because I know you added this whole different, wing on, or building on with all of the staff, because it is becoming one of those things that's so much more popular, I think, these days that people are inquiring.
We had patients 20 years ago saying, hey, you got to bring this in because they're running around trying to scramble sort of in the black market, figuring out what's going on.
Well, we appreciate you both being here, Dr. Jon Mendelsohn and Kati Vincent, both with Advanced Cosmetic Surgery and Laser Center. You guys, always a wealth of information. We appreciate it. I know a lot of you have questions out there. So if you are interested, you can learn so much more and get in touch with their team. All you have to do is call 351-FACE or go to 351face.com. Thanks again for joining us.
Thank you.